Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your lines is in a listen-only mode. You may submit your questions or comments electronically at any time during today's presentation by using the Q&A window located to the left of the slideshow presentation. Underneath it, you'll also see a window labeled Resources where you may download a PDF copy of today's presentation. It is now my pleasure to introduce today's first presenter, AHA moderator Monique Showalter.
Thank you so much, David, and welcome everyone. As David indicated, this is Monique Showalter of the American Hospital Association. All of us here at the AHA hope each and every one of you are safe and well, and thank each of your organizations for your outstanding care and dedication to the patients of your communities. AHA is pleased to be hosting today's webinar entitled 5 Key Innovations Driving Outcomes in a Pandemic, including a spotlight on Baldrige Award winner Adventist Health White Memorial's journey of innovation through COVID-19. This webinar is brought to you through the generous support of the MedMission organization. At the start of the COVID pandemic, Adventist Health White Memorial had to swiftly act to redesign organizational capabilities and support staff to improve wellness and retention. The existing culture of innovation and improvement allowed the organization to repurpose existing technology and expand artificial intelligence capabilities to improve patient outcomes and the staff experience. In today's webinar, Adventist Health White Memorial will share strategies and technologies leveraged to maintain and improve quality metrics and staffing wellness, addressing the challenges faced during the pandemic. You'll hear details on how Adventist Health White Memorial was able to achieve these metrics by recognizing 5 key areas of innovation to deliver outcomes during the pandemic: shifting culture and infrastructure, retooling existing infrastructure, leveraging artificial intelligence and machine learning, including a spotlight on Kate, which provided clinical accurate data and triage guidance to get the right patients at the right time, staff support and wellness, and community engagement. During today's webinar, you'll hear about the key activities required to build and sustain a culture of innovation, how to design organizational capabilities to react appropriately during unprecedented situations, how to engage and support staff in order to improve wellness and retention, and finally, to recognize the emerging role artificial intelligence and machine learning provides in healthcare operations and intelligence. Note, too, that we've allowed time for your questions, which you can submit at any time through the portal on the left side of your screen. We've already received quite a few questions, which our speakers will address as time allows. Note, too, that if you wish to download the presentation, you can easily do so through the resource section of your screen. Also, the event is being recorded, and the replay link will be sent to our registrants and attendees shortly after today's event. So, let me briefly review our agenda and introduce today's highly outstanding speakers. The agenda includes the following: first, my introductions, then a quick overview of the Malcolm Baldrige National Quality Award, and then Mara will be creating an environment for innovation, sharing how activating partnerships for innovation played a role, and then certainly Q&A. So with that, let me introduce our presenters. Today's first presenter is Al Faber, who is President and CEO of the Baldrige Foundation, where he supports the mission to ensure the long-term financial growth and viability of the Baldrige Performance Excellence Program. And he supports organizational performance excellence in the U.S. and throughout the world. Al serves on several board of directors organizations, including CAHME, the Commission of Accreditation of Healthcare Management Education, Standards Council. Welcome, Al. In addition to Al, I'd like to introduce our second speaker, Mara Bryant. Mara is the Operations Executive at Adventist Health White Memorial, an important organization within AHA. Mara leads out key initiatives, including the rollout of Project IntelliCare, implementing the Malcolm Baldrige Business Framework, HIPAA compliance, and TJC preparation. Mara also provides operational oversight for organizational performance, including customer loyalty, accreditation and patient safety, clinical performance improvement, CIS, and health information management, medical coding, and clinical records. Wow, Mara, you're busy. It's now my pleasure to turn the floor over to Al to begin today's presentation. Al, the podium is yours.
Hey, well, thank you, Monique, and thanks to the American Hospital Association and to Stephen Riley and his team at Admission for hosting today's webinar. It is truly a privilege and honor to present alongside Mara Bryant and the Adventist Health White Memorial 2019 Malcolm Baldrige National Quality Award recipient team. I want to start off today's discussion by talking about performance excellence, which is sometimes difficult for many to define, but much like this background, we certainly know it when we see it. For most of human history, quality in almost anything was defined by a leader, and the art of leadership either produced or failed to produce quality outcomes. In the 1900s, management science was born out of the teachings of Frederick Taylor and accelerated during World War II. This gave us decades of process improvement methodologies leading up to today's tools and frameworks which provide organizational discipline. But now, beyond process management and process improvement tools, organizations seek a more holistic and systematic approach to quality, organizational growth, and sustainability. This requires a new approach that not only looks at problems, but also includes stakeholders from frontline workers to all levels of management, their supply chains, and their strategic partners. Consistency in the delivery of products and services is only realized through a culture of relentless commitment to continuous improvement and innovation in both personal learning and organizational learning. Organizational effectiveness, customer stakeholder engagement. And that is how we achieve performance excellence. In short, culture eats process for lunch every day. The Baldrige program has been provided proving leadership and management practices for high-performing organizations and sharing those best practices of national award winners for more than 3 decades. The framework is based on a systems perspective as seen in this graphic on the right. The performance system consists of 6 categories in the center of the figure. These categories define your processes and the results you want to achieve. Performance excellence requires strong leadership and is demonstrated through outstanding results. The word integration at the center of the figure shows all the elements of the system are interrelated. The center horizontal arrowheads show the critical linkage between the leadership triad on the left and the results triad on the right, and the central leadership relationship between the leadership and the results categories. The center vertical arrowheads point to the organizational profile and the systems foundation, which provide information and feedback to key processes and the organizational environment. The basis of the healthcare criteria is a set of core values and concepts that are embedded in high-performing organizations, one of which is a focus on success and innovation. And that is what Mara is here to talk about today. So with that, I will turn the presentation over to her. Mara?
Thank you, Al, and thank you for all the work you do with the Baldrige Foundation. So I want to start by telling you a little bit about our journey. I can honestly tell you I remember the exact day that White Memorial chose to utilize the Baldrige framework as our business model. It was almost 20 years ago. As part of that journey for excellence, we were a very solid organization, but wanted to take our organization to that world-class level and made the decision and the commitment to the journey. In September of 2019, we had 9 examiners spend a week with us, and it was the best history and physical you could ever have. They looked at everything. About 2 months later, we got that phone call from the Secretary of Commerce to my president, John Raffoul, that we had won. So we were very excited, all prepared to go to D.C. and, stand on that stage and get that award. Little did we realize that the journey we had undertaken was actually preparing us for one of the toughest fights we would have, and that was being a hotspot in the 2020 COVID pandemic. So I want to tell you a little bit about Adventist Health White Memorial to start with. First of all, we began as a neighborhood clinic, as you can see on the slide, in 1913. The population of the city of Los Angeles was just over 300,000. Today, we care for more than 2 million people living within 5 miles of our front door. We are the only private, not-for-profit safety net acute care hospital serving East Los Angeles. And we are part of a strong system, Adventist Health, with 23 acute sites. Now I want to introduce you to our community. Our community is about 89% Latinx. We are the largest California population of Latinx. It is a young population. About 46% of our females are of childbearing age. The per capita income is less than $17,000. Most of our residents are living below the federal poverty level. We have been designated as a medically underserved area, and about 97% of our community is covered by either Medicaid or Medicare. Our community has a lot of barriers to health, and is also an amazingly vibrant spirit. They have a history of social activism, an incredible culture, and a community that is deeply rooted in its faith and its families. So I'm going to talk to you a little bit about White Memorial's leadership framework. So first of all, why is it so important to have a leadership framework? Well, on the slide, you'll see what ours looks like today. To paraphrase Lewis Carroll in Alice in Wonderland, if you don't know where you are going, any road will take you there. Going anywhere and going nowhere are both dangerous paths. So deciding what kind of organization you want to be and designing systems and processes to get you there is key. I'm going to discuss our leadership framework, the one that we developed, how it laid a foundation for innovation, and how these innovations proved effective during the pandemic. This model pictorializes many systems and processes that create an environment for success and innovation. Our leadership system aligns our mission and guiding principles, providing a compass for our staff, all of us, during normal times and during a pandemic. So let's start at the base of the model. That red box that contains our mission, living God's love by inspiring health, wholeness, and hope. Right below that, you will see our core competencies. These are the things we identified early on that we are really good at and help drive making us different. We are a mission-driven organization in partnership with our East LA community. We do a great job of caring for the underserved, and we are a data-driven organization in pursuit of excellence. At the top in the green box is our unified Adventist Health vision, transforming the health experience of our communities. Our values or guiding principles surround us in that blue circle. As a faith-based organization, our focus is on our patient and our community. Our aligned strategic planning process, which you can see if you go straight up from our mission at the bottom red box and start going up the cross, you will see our strategic planning process. It includes incredibly active participation with our medical staff, our leadership, our governing board, our key partners, and our associates. We identify our vulnerabilities, and we identify our opportunities to exceed. We are constantly identifying projects that need incremental improvement and those that need radical redesign, always balancing those strategic opportunities with intelligent risks. Our strategic initiatives and projects then are translated into our strategic and operational vital signs, which you see next up on that path. That's our balanced scorecard system. It reinforces our accountability to each other and to our community. We merge those measures into our performance management system and ensure that we are all focused on what's important. And then we deploy teams. Using DMAIC to develop action plans and achieve results, we manage weekly by our strategic and our operational councils. The leadership system is consistent and deliberate about the culture we create and the decisions we make and the outcomes we value. So why is the leadership system important when you're talking about innovation? Well, let's start talking about that word innovation, because it means different things to different people. For some of you, you may think of innovation as only when William Carrier designed the first air conditioner. That is one of my favorite innovations, I have to say. Or when BlackBerry dethroned the iPhone. Some of our innovations are those type of innovations, but we typically don't have innovations made by a solo person working within a castle. I'm going to be talking to you about the continuum of innovation, which we've used the Baldrige definition about making meaningful change to improve services, programs, processes, and organizational effectiveness. And it needs to create new value for your stakeholders. I like how James Barlow talks about innovation in managing innovation in healthcare. He uses words like differentness, a significant departure from the status quo. It's not about that 5% improvement in a process, program, or service. It's those improvements that recreate or create new value to your customer. In every article and book I have read about innovation, the authors discuss that innovation occurs most readily in a culture that supports innovation. So let's talk about culture. What is culture really? Culture is formed and reformed through our beliefs, attitudes, and behaviors. Leadership needs to actively form and reform those beliefs, attitudes, and behaviors into the culture that is needed. In leadership, we often are known for drinking our own Kool-Aid. So in preparing for this presentation, I went out and talked with our physicians, our leaders, our frontline staff, and our partners. How would you characterize White Memorial's culture? The words most often used were trust. Trust likened with a family. Systematic. We learned systematic from Baldrige. Transparent. That open communication, that putting out of our vital signs, and that we're a learning organization. This is where being a teaching institution is so helpful. When I asked about our culture that supports innovation, they suggested our willingness to do some of the things on this slide. Explore the unknown, question the familiar, embrace curiosity. We also talked about having the freedom to think and the encouragement to act, and having an environment that allows for good failures. But I have to tell you, there's a dark side to this culture. This kind of culture can be very unnerving to new people in our organization, and when we interact outside of our organization, we're so used to questioning each other's ideas, thoughts, refining and redesigning and recreating, it's easy for people to think we just argue with each other all the time. But that's really what we do. We're looking collegially. So let's talk a little bit about some of those key culture points. This is where the leadership system comes into play. To support innovation, we believe you must inspire, be transparent, and communicate where you are and where you want to be. You need to involve those closest to the opportunity at hand. In innovation circles, they call this user-led innovation. And you need to trust your people. So let's look at a few of the concepts on the slide. The good failure in that upper left-hand corner. It was a concept introduced to me by the Kaiser Institute over 10 years ago. It's about being intentional about designing a space for good failure, and that it's as important as designing a space for good success. Most of our learning comes from our failures. The best failures create maximal learning with minimal negative consequences. It's about taking the right amount of risk. Well, why else is a good failure helpful? Because innovation is a bumpy road. As long as we are all clear on the objective, the measure we are trying to improve, we can weather the bumps. Right below the good failure are a couple of my favorite books on innovation, along with a term that we have, the Innovation Think Tank. Now, you may think it's fun to participate in an innovation think tank, but I can tell you this think tank works hard. We read lots of books to help inform us on how to improve our culture of innovation and our process for innovation. I'm going to tell you a few things about some of the things we have learned in reading through and learning about the psychology of innovation. First of all, breakthrough thinking rarely comes in a conference room. We deliberately create white space for our brainwaves to move to the creative side. We need to bring people together geographically, taking ideas out of their box and allowing them to mingle and coalesce. At our Strategy Day and Quality Day events, we remove people from the workplace. We place them into different teams and use creative tools like Legos, Lincoln Logs, pipe cleaners to help free our brains. For significant projects, we remove the whole team from their normal workspace, allowing the whirlwind to subside long enough to create and innovate. And also, we bring in subject matter experts on a routine basis so that we can ensure we are improving our leadership and innovation skills. To be innovative, you must create the environment and culture where innovation can seed and grow. And then you must incorporate innovation into your strategic planning process. How do you develop priorities for innovation? How do you share information to use on innovation? How do you support your workforce in taking intelligent risks? How do you manage resource and ultimately decide whether or not to pursue opportunities for innovation? Cleveland Clinic talks about their 10 commandments of innovation in Thomas Graham's book, Innovation in the Cleveland Clinic Way. The author talks about innovation as a discipline that can be practiced, learned, taught, and measured. He talks about identifying the opportunity that is aligned with strategy and vision, and he emphasizes that innovation needs to be close to care, not in a conference room or a science lab. This philosophy mirrors ours at White Memorial. The purpose of this slide is not for you to read the 8 steps in our organizational or departmental innovation process, but more importantly, to demonstrate that you do need a process. Some of the things you need to think about when you design your process include, how are you going to get those good ideas? How do you free those ideas to connect, fuse, recombine? And how do you expand into the adjacent possible, building on the works of others? The best ideas occur when people are talking with each other, not by themselves. Innovative environments balance order and chaos. So here are a few of our innovations that occurred pre-COVID. So using our leadership system model, understanding our core competencies of mission-driven partnership, serving the underserved, and data-driven pursuit of excellence. By optimizing those, we were able to create new value and take intelligent risk, addressing some critical paths for our organization's success. On the slide, you will see 5 different innovative outcomes achieved pre-COVID, utilizing all the systems that we've been talking about. These innovations I will revisit in our intra-COVID experience. So, this is our blessing. This is a slide showing our COVID inpatients since March of 2020. It may be strange to think of it as a blessing, but for us, Wave 1 and Wave 2 allowed us to redesign significant workflows, educate ourselves and our community on safety in the COVID world, and bolster our personal protective equipment, supply chains, and all of that before that third wave pounded us. Now that you're familiar with our past and you can see our pandemic waves, I want to share with you a number of innovations from pre-COVID times that enabled us to ride that tidal wave. First, I want to focus on our community. I want to connect back to our original discussion. We realized very early on that we had some significant gaps in our community and healthcare infrastructure, and we needed to leverage key relationships to move quickly, expand beyond our facility footprint, meeting our community where they needed to be met, outside our walls. The first had to do with community testing. Early on in the pandemic, you have to think back now, a whole year, Latinx were very underrepresented in overall testing volumes, masking the devastation we were observing in our community. As Dr. David Hayes Bautista classified them, our community is composed of the invisible essential workers who were not able to shelter in place. They came from industries such as manufacturing, construction, transportation, and the food industry. Additionally, as I described in the beginning, they live in multi-generational, multi-wage earner, multi-family homes, increasing the overall COVID transmission risk exponentially. We needed to make sure our community had access to community COVID testing. It was an intelligent risk to take. We did not have our own testing supplies at this point, so we weren't able to just say, okay, let's open a testing site. We did not even have a machine at White Memorial that had COVID testing on it. Dr. Hector Flores, one of our physicians, worked with the mayor's office and Supervisor Hilda Solis's office to obtain a vacant city lot across the street from our emergency department, testing supplies from the county, and organized staff from Altamed and ultimately Dr. Trenkle, another one of our physicians, to run a testing site that is open to this day in Mariachi Plaza. During the pandemic tsunami, the site under Dr. Trenkle's team was collecting over 400 specimens a day. I want to move over to our SNF outbreaks. In Los Angeles, the pandemic hit first in our skilled nursing facilities. White Memorial is surrounded by large and small skilled nursing facilities. A major outbreak at a local SNF could endanger our ability to continue to manage the COVID population and volumes that were going on. Immediately, we identified 18 facilities that we reached out to, first in the form of an official letter introducing ourselves and what we wanted to achieve, and then it transferred over into weekly telephone calls, checking in on each other to see how we were both doing. We were able to help facilities with supplies that they were not able to obtain, COVID testing to help them make appropriate isolation cohorts, and then simply to remind them that we had their back. Without these partnerships, we were on the brink of being inundated with SNF transfers to try and control outbreaks. Ultimately, the Department of Health was able to organize, supply, and test the SNFs, but this early innovation project helped us through some very difficult weeks at the beginning. And then at the bottom of the slide, pre-COVID, East Los Angeles is identified as a food desert with few retail food stores. As the restaurant and hotel industry shut down and a large section of our community were furloughed, school lunch programs were closed, conventional senior and homeless food services were suspended or closed. So early on in the pandemic, our community liaisons identified an increasing level of unmet food needs. Through partnerships with White Memorial, the YMCA, and USC, we were able to deliver the volumes of groceries that you see on the slide. Over 25,000 grocery bags to seniors and disabled, 155,000 grab-and-go meals, and 17,000 meals to the homeless. Starting in June, we moved all this effort over to our pandemic food relief site that's located at our community garden. Through December, we were able to distribute over 36,000 additional fresh grocery bags and 3,500 deliveries of 50-pound fresh grocery bags to the homes of our seniors. This next project I want to talk about is also long in the making. This was an innovation project that started back in 2002. It's a great example of an intelligent risk in the face of staffing shortages. We chose to partner and invest and continue to invest in training so that we form the next generation of healthcare workers. In a community where only 54% have high school degrees and 90% of our kids don't even go to college, our workforce development programs engage and mentor high school and college students. We're especially proud of the one that's on the screen. This is an investment in creating nurses, individuals from our local community who want to become healthcare professionals. When we started this partnership with Telecu Education Foundation, Latinx nurses were less than 3% of our workforce. We chose to create a critical path, a pipeline for our future healthcare professionals that also created value for our community. Today, over 35% of our nurses are Latinx. We believe care is improved when it is provided culturally competent and linguistically competent staff. Additionally, the program made meaningful change in the community. To quote David Lizarraga, the founder of Telecu and our partner in the Telecu nursing program, we create an opportunity to build a legacy for a family. During the pandemic, the trust that had been created through these training programs truly helped mobilize large amounts of need for the hospital in terms of resources. Additionally, the current students that we have in this program help to initiate our prevention strategies. Telecu nurses, along with Cerritos and Rio Hondo School nurses, are staffing our COVID vaccination and flu clinics to this day so that our associates could stay focused on the waves of COVID patients arriving each day. Also early in the pandemic, it became very clear that two items threatened to cripple us: managing staff who had been potentially exposed to COVID and the speed at which we could receive COVID test results. All of us are really spoiled now because we can get our COVID test results so fast. But if you remember back at the beginning, it was taking anywhere from 3 to 7 days to get your COVID results from the outside labs. During that time, someone who would surprise you at being COVID positive, you had a lot of exposed staff in those days. We moved quickly on this first item. Staff who were exposed and sent home found themselves in isolation without routine communication. We saw it increase the fear factor in our staff. Telephone calls from employee health were problematic also. We couldn't get to everybody. Plus, we were told that it interrupted our night shift sleep patterns. So within 3 days, we met with a key business partner, and we adapted our SMS texting platform that we use for out-of-network capitated patients into a platform texting staff regarding signs and symptoms of COVID infection. Staff participation increased to 71% of our inquiries were returned. We were able to reduce the manpower required to maintain the system by 82%. The second example focused in on receiving COVID test results timely. As we redefined our workflows to minimize staff exposure to possible COVID-positive patients, it became very clear that automating the results from the outside laboratories was crucial to improving the safety for our staff, treatment initiation, and throughput. The process started with very traditional processes. You couldn't believe it. We had to log into external labs' websites, and then we thought we were doing really great when we automated it to faxes. But one of our staff created a concept utilizing our HIPAA texting platform and expanding it to receive and keep COVID test results so that it was easily retrievable for care, accessible remotely for our infection prevention department, and helpful in reporting to our Department of Public Health. Another rewarding innovation was in our emergency department. We had gone through at least 7 improvement cycles to improve ED throughput, including a complete rebuild inside our emergency department. After the rebuild, I remember our chair of the board, Scott Reiner, commenting, "Mara, there are 2 million people around us. I don't know if you can build a big enough emergency department." We knew we needed to do something innovative, and our rebuild had made that incredibly clear. We identified if we did not get it right at the very beginning, during triage, it all falls apart after that. When you look at the literature, typical triage acuity accuracy is about 59%. That seems a little alarming. It's almost like flipping a coin. But factors that impact that accuracy are real. Race, gender, social bias all play a role. Atypical presentations for diseases. Environmental conditions such as crowding and boarding of patients. Interruptions in the delivery of care. And time constraints all cause inaccuracies in triage. And let me tell you, during the pandemic, none of those things were happening in our hospital. Just kidding. We partnered with MedNation to develop the first in kind, clinically accurate, real-time guidance by nurses for nurses. The Kate concept came from a real ED triage event with the co-founder's daughter, Kate. We developed the AI triage system by aggregating over 100,000 real experiences, read in its entirety in the medical record, including free text, and provide data-driven and individualized guidance, only when you need it for the patient in front of you. Kate improved triage accuracy to 92%, even on our high-risk presentations. We have published this study, and you'll see it soon in the Journal of Emergency Nursing. Our nurses love Kate. They feel like Kate has their back. They get in the moment learning. If they make the wrong assignment, as you can see on the screen, the nurse assigned a 3, Kate assigned a 2, it will tell the nurse why Kate decided that level instead. And the nurse can either agree with it or override it. So it constantly gives feedback. It's very simple to use, and the staff are contributing back to the learning of the system. I asked Dr. Stephen Liu, our Emergency Department Medical Director, what he appreciates most about Kate. He said, "I do not have to worry about what is in my waiting room." The benefits have been tremendous, and we have rolled Kate out to other Adventist Health sites even during the pandemic. Additionally, you can see we've been able to show our ROI. So it's very cost effective. It helps patient care. It decreased our ED staff turnover. There were so many benefits that occurred when we implemented Kate originally. So, obviously it helped during the surge. Nurses were stressed. We had so many patients holding for inpatient beds and trying to accurately triage new patients. Kate helped protect us during the pandemic. I also wanted to share with you an incredible addition to Kate that was developed and implemented in the middle of the COVID pandemic. We actually went to the staff and asked, "Do you want to add on to Kate?" And they all said yes. We expanded our investment in Kate AI to include early sepsis detection at triage. Pre-COVID, sepsis mortality was a top clinical initiative for us. We were following the evidence-based sepsis screening, reviewing fallouts weekly, training staff, but we weren't moving the needle on mortality. And what we learned is that the simple algorithms miss a lot of septic patients, delaying antibiotic administration. Our new Kate sepsis model was identifying septic patients 31% better than the established published protocols from the Surviving Sepsis campaign. This innovation helped us to improve our 1-hour sepsis bundle compliance by 87%. It reduced our median antibiotic administration to just 19 minutes. And we know that getting timely treatment involved helps with mortality. And we did this with only a 2% increase in sepsis alerts. And this is at triage. So we have no labs required to get to our definition and our diagnosis. The nurses and providers at White embrace this new AI and are looking forward to publishing these findings and contributing back to the fight against sepsis. Finally, I want to talk about how our community had our back during the pandemic. We had a lot of innovative programs with our community pre-COVID. And because of that, we were outside our walls on a consistent basis with our community. It developed a trust between us and also the ability for the community to understand our needs quickly. So some of our community supporting innovation was with resources. On the slide, you can see community leaders and supporters demonstrating their willingness to support Adventist Health White Memorial because we are focused on the well-being of our community. Our philanthropic foundation worked as hard as hospital operations during COVID, finding new and non-conventional sources to meet our needs. That support in the form of dollars, PPE, supplies, and basic needs such as food, tennis shoes, housing, allowed us to provide excellent, safe patient care in the middle of a pandemic. Our staff saw this visible support, and it aided in their resilience. Our community had our back. So finally, I want to really emphasize a key belief. Leadership needs to inspire. They need to inspire innovation. This saying is one of my favorites when I think about how to achieve great feats. It says, if you want to build a ship, don't drum up people together to collect wood, and don't assign them tasks and work, but rather teach them to long for the immensity of the sea. It is our responsibility to create the culture for innovation. We must be willing to make meaningful change and create new value for our stakeholders. We must create supportive environments and embrace intelligent risks, learning from our good failures. We must intentionally design for innovation. I believe our post-COVID world will demand it. Thank you. I'll open it up to questions.
Thank you so much, Mara, for what was truly an outstanding and impressive story, inspirational in many ways. Congrats on certainly White Memorial's success in that journey. So now as I mentioned earlier, we have allocated some time for your questions. Although we've already received a number of questions, we welcome any additions that you might have. First and foremost, one of the questions, Mara, and I'll direct it to you, relates to post the pandemic. How do you anticipate supporting what we all know will be an overworked and likely aging workforce, especially given their potential burnout?
I can completely appreciate that. You know, it is a subject that we are constantly discussing. Resilience has kind of two avenues for me. There's that very personal part to resilience where we have services, I think, like most people do with EAP and those type of things. We also had a very active, because we are a faith-based institution, a very active outreach to our staff on that spiritual level, with prayers going on, services you can join, blessings of the hands, things of that nature. So we'll continue to work on that personal side of resilience, but probably for me the more important is being able to turn from the emergency of the moment into a more optimistic future. I can tell you that our staff are so excited just about being able to give vaccines. They see that as such an optimistic future for our White Memorial community. And then also we're excited because our system has identified us as a Blue Zone site. Blue Zones is a very specific community outreach process. Our Adventist Health system actually purchased the Blue Zones company, and so White Memorial gets to be one of those initial innovative sites. So I do believe that a lot of it will be about being able to get out of the emergency of the moment and begin to look at a future that is bright and happier.
That's great, Mara. Thank you for sharing your perspectives on that. Your story and information related to the adoption of Kate drove a question. Did that adoption require a lot of IT investment?
No, actually the system is incredibly easy. It goes over smartphones. It can get up and running in no time whatsoever. So it's actually one of the easiest implementations I've ever done.
Great. How do you go about sustaining your innovations, Mara?
Well, for us, it goes back to that same discipline of identifying the project, the strategic priority, and then ensuring that we have strategic vital signs. So when we make big investments to change how we provide care, we always make sure it is accompanied with a set of measures that continue to measure on those key activities. And we have a pretty rigorous system of not letting them drop off. So for us, our philosophy is they stay in strategic vital signs until we have a good, solid performance for about a year of no variance. So you'll get your year or two of improvement, your year where you're just solid. And then we don't drop you. We move you onto our operational vital signs where we may watch that forever. So we have this kind of set of vital signs that we're constantly reviewing every year, isolating out those things that are change the business to make sure our focus is on them, and then our run the business scorecard also, so that nothing falls off when it kind of gets back into the norm, or as we call it, moving it into operations.
That's great. Also, a related question to that, what characteristics do you look for in a partner when deciding to take on an out-of-the-box or innovative project or technology?
A very good question. So I often think it's very similar to deciding to hire a new employee in many instances. You need to find an organization that fits you, fits your philosophies, your thoughts, what you consider to be important. Now, obviously, if it requires a huge dollar investment, then you're going to do a lot more research around how long they've been in business, how financially solid are they. But outside of that, so like we can use Kate for an example. We were looking for an innovation. The owner of Kate came to us and said, will you try and do this with us? And we looked at it. All we had to do was provide our time, which we were already investing into performance improvement. He really brought all the technology and the science to the table, and then we worked together to create Kate. So, in that instance, I was not investing $1 million to make something work. So, the importance for me was that I had a partner who had the same philosophy around serving the underserved, being part of our team, and could be just almost cohesive with our own staff.
Great. I'll give you a little bit of a break, Mara, and I'll direct the next question to Al. Al, what are the benefits for healthcare organizations to start the Baldrige Quality Award journey? Can you help us on that?
I think there are a number of benefits that are realized by all organizations that embrace Baldrige. But as I travel the country and talk to CEOs, and especially of healthcare organizations, one of the things that is consistent in their messaging back to me is that everybody starts with a strategic plan. Let's face it, everybody who's dialed in today, their organization has a strategic plan. It's bringing that strategic plan to life throughout the organization, the execution of it, that is the true challenge. And so how do you do that? Well, organizational alignment. And one of the things that Baldrige helps you do is achieve an organizational alignment to where every stakeholder in the organization has a clear line of sight to the top, the mission, vision, and values of the organizations. Because one of the things that you learn in embracing and using the Baldrige framework is that innovation is not necessarily a top-down driven event. You get innovations from every part of the organization, and many of the best innovations come from the bottom up, not necessarily from the top down. So it's that organizational alignment that is really key to CEOs out there that helps them, wherever they are in terms of their current performance, take it to the next level.
Well, that's great insights. Thanks. Back to Mara. When does implementation of a best practice also reflect innovation for a healthcare organization?
Well, for us, it is not unusual for us to borrow best practices from other areas. I can tell you, and I don't even remember how many years ago it is now, our vital signs database process was actually mirrored after Texas Nameplate, who won the Baldrige a very long time ago. So it's a very small business, and when I went to their conferences and listened to their story, I learned that I was completely selling my own company short in our ability to manage through a data-driven process. They had, Texas Nameplate, the typical employee did not even have a high school diploma, and they were working in sophisticated data. And so I was able, I watched that, and I was able to take that back over 20 years ago to improve the systems at White Memorial. So when I see best practices and say it's innovative, often it's about learning from another system, culture, industry, and then being able to look at it and say, not about what's different about them, but saying, how are we alike, and what can I learn and take back to my organization and create it in a new way to fit my organization and the work I need to get done, and then launch it out in a way that creates substantial new value to your organization.
Fabulous. Thank you. Next question again for Mara. How did you deal with the changing government measures and expectations?
A lot of communication. I think, one of the things that Baldrige helped us with in terms of our workflows and systems, it also helped us to identify how to pull apart a project and assign it out, and the fact that we were very trustworthy of each other. So we had people who their whole job was to listen to the government, listen about what's new, what's coming up on the radar screen, bringing that back to our collaborative teams and task forces that helped during Baldrige specifically, during the pandemic, and then also, in our regular, normal working business, and then be able to talk about how that will work for us. I think additionally, one of the things that might be a little unique about our situation, because we are most federally and state and federally funded, we have very strong relationships already with, our local government, the state government, and the federal government. And being able to access those to help influence how some of those policies played out in the real world, giving them a real world perspective, I think benefited both of us.
Fabulous. Another question. Is it feasible, in your opinion, Mara, to handle an organizational restructure during a pandemic situation? And what, in your opinion, would be the key areas to ensure a reorganizational or restructure being successful?
I think the biggest guidance is that restructures take a lot of organizational energy. Pandemics take a lot of organizational energy. If you want the redesign to really be embraced, during the pandemic, I'm not sure people had a lot of extra energy to be able to understand new systems, new processes, things that for them were immediate to their survival of the day. So depending on how dramatically you were impacted, I guess would be the key point on whether you could do it or not. I know in our particular case, because we really had a significant surge here at our local area, we needed to stay focused on saving lives and taking care of patients. So it would have been very difficult for us to do a major redesign in the middle of that. If your participation in the surge was a little more remote, it might have been absolutely fine. So it just really depends on the dynamics, but I can't emphasize enough being able to tap into understanding the energy of your organization and how much is being consumed and how much is left over. That's always a balancing act during pandemics or during normal years.
Great. Another question. How can White Memorial take the lead to immunize everybody in its community instead of spending money and time testing only? Interesting question. This could be a prize-winning pilot project and needs to get 1 million doses now and save many millions of dollars and lives later. There's a softball question for you.
I know that's one of my doctors, so absolutely, that is where our attention needs to turn to next. And like I said, I think it's also a path to resilience and recovery for our staff. In our particular instance, we're already pulling together key partners to develop a comprehensive plan for immunization in the inner city. It's a little different than immunization in suburban America, for instance. So if you've looked at the numbers recently, you'll see that the Latinxes are not getting immunized. There's a number of barriers that cause that. You have the fact that most of them are drive-through events. Much of our population uses public transportation. They don't have the ability to drive through. So it's about, and many of them don't really have the aptitude or the access to the online signups. So we've seen our community get underrepresented in vaccinations. So our approach has been teaming up with some key partners here in the community, reaching out right now to some key senior populations. Like right after this event, I'm going down to Telecu, one of our senior housing projects, and we're working on vaccinating all the seniors in that project. That's the type of work we're going to need to do in order to get our population vaccinated. It is tricky, though, because I can only vaccinate when I have vaccines, and right now I get 1,000 vaccines a week. So I'm working on that, too, trying to get more in place, but that's kind of our approach to vaccination. I completely embrace that idea of getting 1 million people vaccinated.
Thank you so much. And that concludes the time we have available for today's session. Shortly, all of you will be receiving an email with a link to both the webinar replay as well as the presentation for download. We welcome your sharing that with others in your organization and beyond. So sincere thanks certainly to Mara and Al so much for your having shared such information that's invaluable. And also thanks to our sponsor, MedNation Organization, and certainly thank you to all of you for making the time to participate in today's webinar. That concludes today's program. Have a wonderful afternoon, and please stay safe and well.
Thank you.
Thank you, Monique. Thanks, Mara.
Ladies and gentlemen, that concludes today's presentation. You may disconnect your phone lines, log off your webinars, and thank you for joining us this afternoon.